We've been doing research for many, many years on the effects of alcohol in pregnancy. And the first thing that was observed, of course, was the Fetal Alcohol Syndrome, which is a constellation of factors that include physical features, growth retardation, and significant damage to the brain, producing neurodevelopmental deficits. While some children were born with the fetal alcohol syndrome, there was a much wider spectrum of results of exposure. We had identified a mathematics deficit over and over again in children who were alcohol affected, and a number of other researchers had done so as well. We also felt that the kinds of deficits we saw in terms of visual spatial problems and so on were probably likely to be related to math problems. It's certainly true that many children who have FASD have problems with executive functioning as well. And many of them have problems with what I call arousal dysregulation, which is the ability to self-regulate. Children who were alcohol affected tended to be show an inability to respond promptly to things, so they had errors of omission when they were performing tasks. The cognitive kinds of neurodevelopmental deficits may be different at different ages. However, if you happen to be a skilled clinician, you can identify those things at any age. I would argue that it's a very good idea to try to identify this problem as early as possible, because the earlier you can identify it, the more effective your intervention is likely to be able to be. There are not adequate resources in the school systems to provide the educational interventions that are needed. So I think there's essentially a crisis going on in the field, and we need more advocates who will speak up for the people who have this disorder and for everyone who's been trying to help them all these years. Half of pregnancies appear to be unexpected, and therefore many people are not aware when they become pregnant that they are doing so, and that many of them have been drinking at that time. So I think there is always a concern about whether or not people are aware of the effects of their drinking during pregnancy. I think the most serious problem is people who drink excessively, who are not aware of the effects of their addiction and are not aware that they don't have control over their drinking and are not using appropriate birth control. And again, we find that many people in this country are not doing so. So I think that the idea of the alcohol-exposed pregnancy being a matter of concern for many people is still an important one.